Bonjour à tous. Merci d'être là. Et voilà, je suis Etienne Bernard, je suis le CEO de NuMind. Et je vais vous parler un petit peu du modèle qu'on a créé qui s'appelle NuHealth, qui est un large language model spécialisé pour l'extraction d'informations des documents médicaux. OK? Alors, j'avais aussi prévu des démos, mais là, avec le partage d'écran, je vais avoir un peu de mal. Mais on va continuer avec la présentation. Alors, juste d'abord pour vous dire un petit peu ce que est NuMind, on est dans le domaine d'extraire de l'information, c'est ça qu'on fait. Notamment extraire de l'information qui est difficile à extraire, donc des problèmes assez compliqués d'extraction d'informations. Et pour ça, on fait deux choses. Un, on crée des modèles fondations qui sont spécialistes pour extraire l'information. Et deux, on customise, on spécialise ces modèles pour des problèmes particuliers pour des entreprises. Voilà, pour faire simple. Donc alors, de quoi je parle quand je parle d'extraction d'informations? Nous, on modélise les choses par ce qu'on appelle l'extraction structurée, c'est-à-dire transformer un texte en un fichier JSON. Et avec ça, on peut extraire des entités, on peut extraire leurs relations, on peut extraire vraiment ce qu'on veut, on peut même faire juste de la classification. Donc c'est un peu une tâche qui permet de tout faire en termes d'extraction d'informations. Voilà notre exemple. Donc ça, c'était une discussion patient-docteur, où on extrait différentes choses, comme la température qui a été prise, la pression sanguine, etc. Ça, c'est un autre exemple d'une réaction chimique. Donc là, il faut identifier les composants chimiques, leur quantité. Donc là, vous voyez, il y a une relation entre les deux qu'il faut extraire. Et aussi les classifier en fonction de leur type. Voilà, dans un autre exemple, et il y en a plein. Et donc voilà, les cas d'utilisation dans le domaine médical, il y en a plein. Les plus classiques, c'est juste... I just realized I've been speaking French the whole time. I'm really sorry, I'm going to switch to English. All right. So the most classic is to populate electronic health record from clinical notes, medical coding, all right? So identifying diseases, symptoms, and things like that, and giving them the right code, and which is mostly for reimbursement claim for insurance, or for an hospital, for the government to get reimbursed the right way and stuff like that. So there are many use cases. And before NuHealth, we created NuExtract. This is an open source model. It's a small model, 3.8 billion parameters. And I'm not going to be able to do the demo because of the screen sharing, but that's OK. Basically, the idea is that you give it a template of what you want to extract. So you can imagine, let's say on the patient-doctor conversation, you just give a JSON, which is empty. It doesn't have the symptoms. It doesn't have everything else. And then you give the text, and then the model extracts the information in a zero-shot way, so without customization. And what's interesting is that even though this model is very small, 3.8 billion parameters, it's actually better than GPT-4o. I say better, it's pretty close. It's not really a big gap, but still, even though it's 500 times smaller than GPT-4o. And obviously, our model is not smarter than GPT-4o, but it compensates by being specialized for information extraction, also reducing hallucination, and also following scrupulously the template. That's where it gains the point. And it's multilingual. And why would you need this model? Well, it's because you can use it privately, because it's small. And also, you can customize it, so you can fine-tune. These big models are harder to fine-tune. This one, you can reasonably easily fine-tune it, and so you can get a model that is very high performance and run privately. And so, based on the success of NuExtract, so this is something that is quite used. We had 100,000 downloads on Hugging Face last month for NuExtract. We decided to specialize in some vertical, and we started with health because we believe there's the biggest need of processing data with high quality in a private way. And so we created NuHealth, which is really NuExtract, but specialized. Where is my mouse? Here you go. Specialized for health. And so it's exactly the same thing as NuExtract, but we're adding new data, healthcare data. We also trained it to solve some specific standard tasks like ICD-10 coding. And yeah, and so that's what we created. And it's still an early project. That's really early result. You can see by the quality of the plots. We see, which is not surprising, that we're quite better than GPT-4o, but we hope to push that even further, maybe to increase the size of the model and also to measure that a little bit better. So yeah, that's NuHealth, and I would like to show you a demonstration. How many time do I need? Okay, but I might have to do a little bit of. Okay, let's see. I'm gonna try to. Okay. Let's see if I can. Oh, it's there. Can I bring it? Yes. Okay, great. So yeah, that's a demonstration of medical record. And so it's exactly like NuExtract. It extracts a JSON. And sorry, it's a little bit small. You probably don't see anything at the end. I'm going to try to make it bigger. All right, so patient information, name, age, and so on, symptoms, and things that NuExtract was definitely not able to do, like finding the ICD codes for the symptoms and for the disease. So that's a value of NuHealth, and we intend to improve it for ICD code and add also the other norms, so it can do all classic tasks of healthcare. Okay. All right, and so how do you use NuHealth? Well, what we propose at NuMind is this enterprise solution, which is to customize it on your data, especially if your task is a little bit atypical. That will improve performance a lot. And then to provide a way to serve it efficiently with an inference module. And okay, my mouse is not responding. That's all right. And but one important thing is that we also want to put a human in the loop in production. And it's important because in healthcare and in other domains, you often want perfect data. Like you cannot allow to populate your database with erroneous extracted data. And so the way that it works is that the model estimates the confidence it has on the prediction. And that's something that is a bit unique. If you use GPT-4, it will give you a result. It's really hard to make it tell you if it's confident or not about the result. And if you don't have this confidence, this whole system cannot work because a human has to review everything. So, okay, it will speed things a little bit by being pre-extracted, but not that much. But because we can measure the confidence of the model, we can only redirect a fraction of the document in production to a human. Let's say there's 5% of error, we might just redirect 10% of the document. If there's 1% of error, maybe we'll redirect only 2% of document to a human. And then the human can just have to correct because it's pre-annotated. We also can show where the potential errors are because it's not just the confidence at the level of the document, it's also the confidence at the level of the extraction. And make this process extremely efficient. And also the nice thing is that as the human corrects these difficult documents, you create new training, you create new data. The document that you really care about, the hard documents. And so you can use that with a training module to update the model and improve the model. So it's a virtuous cycle. You start with a pretty good model, it's NuHealth that is already a model specialized for healthcare, then you customize for your data, and then you keep on improving it during its lifetime. And we believe that's the way to solve this hard problem like medical coding, to solve these problems. All right, and so, okay, my thing is completely, I have no control of my computer at all. So the next slide was just resuming summing up the interest of using the NuMind Enterprise, which are privacy, which are perfect performance with the human in the loop, and the confidence, and an improvement of the model as we go. And that's it. Thank you very much. Yes. And also maybe other ontologies coming. Yes. And how do you plan to Yeah. That's true, that's true. That's super interesting. And even how we trained NuHealth, I can tell you a little bit about that, because there's not a lot of publicly available data. So we put all the publicly available data we can, but then we have to generate synthetic data. And I can give you, I don't know if it should be a secret or not, but one thing we manage to generate, because you cannot ask even a frontier model to generate medical documents. It's going to be very bad on diversity. You're going to have a lot of gaps of knowledge of disease that you haven't covered and so on. So tell you, we are grounding it in, like, let's say, the ICD-10 notice that has all the disease, that has even like symptoms and so on. And so by doing by using this information, we are able to create synthetic data that is very diverse, that covers kind of everything there is to cover in terms of disease and diagnostic and symptoms. And by complementing that with real data, that's how we create. But we're on the lookout for more real data. So if you want to partner with us, don't hesitate. We want to improve NuHealth. I hope this answers your question.